Are you suffering from complex PTSD and are not sure if EMDR therapy would be good for you? Then this video you might want to listen to. If you're new to my channel, my name is Tracy and I'm a licensed clinical psychotherapist and in private practice, and my specialty is trauma and dissociation. So let's start off by talking about what is complex PTSD versus PTSD. So the DSM, the Diagnostic Statistical Manual, identifies PTSD as a single incident, whereas complex PTSD, which is not in the DSM, but it's under the umbrella of PTSD, is where growing up in your childhood, for example, you were exposed to chronic and consistent adverse experiences. So, in psychology, we have what's called the adverse experiences assessment, where there are 10 questions that ask if you, for example, were either exposed to emotional abuse such as a highly critical parent, judgmental, cold, dismissive. They tend to gaslight you, minimize your feelings, make you feel unloved or unworthy, or tell you that you're worthless, you'll never amount to anything. So those are some examples of emotional abuse. And then there's physical abuse or witnessing domestic violence, any kind of sexual trauma. Maybe you moved repeatedly, school to school, neighborhood to neighborhood, having to start over with new friends all the time, or way more often that was comfortable. Maybe you had challenges in school. Maybe you were exposed to bullying. Those are some examples. A big one is growing up with a parent or a caregiver who had mental illness or struggled with substance abuse. And parentification. Parentification is where the child is made to feel, either intentionally or unintentionally, they're made to feel like they are responsible for their caregiver's emotions. It's not supposed to work that way. That's backwards. So adverse experiences in childhood are those repeated or maybe difficult, really difficult, painful situations that when the child grows up into adulthood, they carry the wounds of those experiences, either big T traumas or small T traumas, right? Small T traumas are the non-life-threatening situations, and the big T traumas are the life-threatening situations, such as car accidents, natural disasters, that sort of thing. But make no mistake, just because one threatens your life, the small T traumas are very impactful because it changes or shapes the trajectory that that individual grows up into adulthood into. So if they carry a lot of the wounding that's unhealed, they tend to have like those 4 F's of trauma: fight, flight, freeze, fawn, and a lot of those symptoms. So hypervigilance, avoidance, shutdown, freeze, dissociation, anger. So that's complex PTSD kind of stuff. So if you're struggling with that condition or disorder, I highly recommend that you find a certified therapist who is trained in EMDR, because if they're trained in EMDR and are certified, that means that they're more likely to be dedicated to learning and getting more extensive trainings throughout their career for EMDR treatment to help their clients. Because when you have complex PTSD, it is just that. It is complex. And we as therapists don't want to make your symptoms worse. So training is really important. And if you find a certified therapist, they're trained in a lot of modalities, because to treat complex PTSD, it's not just EMDR that we use. We use a little bit of this, a little bit of that, and we mix and we pull from different modalities, such as somatic therapy. Somatic therapy is the soma is the body. So if you have activated nervous system, you're in that sympathetic arousal state, and you need to calm that nervous system. A therapist is going to teach you how to calm that nervous system. And there's so many skills and coping skills for that. So somatic therapy, parts work, I almost always at some point or throughout a treatment with a client, I will use parts work to either clear blockages or to look at things from a different perspective, to lift the burdens of the inner child parts that so many people carry. We'll use other treatment modalities like CBT to address those patterns of maladaptive thoughts, like catastrophizing, fortune telling, all or nothing thinking. I almost always, when I have a client with complex PTSD coming in to see me for treatment, they tend to endorse a lot of those cognitive distortions. So we'll do a lot of CBT before we get into the trauma work. We use DBT, dialectical behavioral therapy, which will help the client with emotion regulation skills or distress tolerance skills, because we have to teach the client how to manage and deal with stressors or triggers when they're happening, to help them stay in that window of tolerance and to calm the nervous system, or to jumpstart the nervous system if they're in that freeze mode, shut down, numb, disconnected, flat, right? So we want to jumpstart that nervous system and help them come online again, so to speak. So, and there's other treatment modalities. So with EMDR, we use a mix of those modalities. And we can also modify the EMDR protocol. So somebody who's coming into us with just PTSD, a single incident, we would probably just follow the standard protocol, which I know it doesn't mean much to you if you're not trained in EMDR, but it's a very structured protocol. When you have complex PTSD, we have to adapt it and modify it. There's all kinds of tricks and interventions that we can do, because our number one goal, and it's our responsibility as the therapist, to keep the client in that window of tolerance. Because if they're not in the window of tolerance, they are not going to effectively process and heal from those trauma memories. At the time of the wounding or the trauma, it becomes trauma because it's stuck. It's not integrated. The body has not processed and digested the material or the energy or the emotions to be able to file it away as, oh, that happened in the past. I've processed it. I've healed from it. I'm okay with it, and move on. It's trauma because it's stuck and it's trapped. And our bodies hold all of our experiences, and they either lay dormant or they get activated depending on the trigger or the stressor. So if you're thinking of getting EMDR therapy and you're not sure, I hope this video is helpful, because again, if you find someone that's certified, they usually, I'm going to say 9 out of 10 times at least, have training in different modalities to use in conjunction with EMDR therapy. And they will meet you where you are at and slowly build you up to be able to do the trauma work, to dip your toe into the trauma, into those adverse experiences. If you like the video, feel free to subscribe, and I will see you next time.